Diabetes usually does not kill in one dramatic moment. Most of the time, it moves quietly, silently, from behind the scenes. First, it puts pressure on the blood vessels. Then it begins to silence the nerves. Then it wears down the kidneys. Then it makes the heart more vulnerable. And by the time many people realize how serious it is, this is no longer just about high blood sugar. Now it is about stroke, coma, amputation, organ failure, and sometimes death. Some diseases arrive with pain. Diabetes often arrives with silence. Maybe you feel more thirsty than usual. Maybe you wake up more often at night to urinate. Maybe your vision becomes blurry for a while. Maybe your feet feel numb. Things many people dismiss as stress, aging, fatigue, or simple dehydration.
But here is the dangerous truth. Diabetes does not need severe pain to damage your body. It only needs time. In this documentary, we're going to look directly at how diabetes kills, what death from diabetes can actually look like, what warning signs appear before the crisis, what family members should do if someone is in serious danger, and most importantly, what must be done so it never reaches that point. This is not just a video about blood sugar. It is a survival guide.
The biggest mistake people make about diabetes is believing that diabetes is just a number on a meter, as if everything comes down to a small screen. One reading, one warning, and that is all. But diabetes is not just a number. Diabetes is a process of biological damage. When blood sugar stays high for long periods of time, excess glucose does not simply float harmlessly in the bloodstream. It binds to proteins. It damages vessel walls. It reduces the natural flexibility of tissues. It increases inflammation. And over time, it creates an internal environment where damage begins to build from the inside out. That is when diabetes becomes truly dangerous, because the damage is often slow and quiet. Many people wait for a big sign, a strong pain, a dramatic event, a symptom too obvious to ignore. But diabetes usually does not work that way.
It can progress for years while a person is still going to work, driving, shopping, laughing, and believing everything is under control. On the outside, life looks normal. On the inside, the damage is accumulating. Blood vessels that should stay flexible begin to stiffen. Nerves that should carry signals clearly begin to slow down or fail. Kidneys that should filter the blood are placed under constant stress. Eyes that should see clearly are slowly being damaged from within. And this is one of the most frightening realities of diabetes. By the time the first serious symptom appears, a large part of the damage may already be there.
One of the most dangerous myths about diabetes is the belief that it is a disease of old age. That idea is wrong and costly. Type 2 diabetes, prediabetes, insulin resistance, visceral fat, inactivity, poor sleep, chronic stress, poor diet, and family history can start pushing the body toward damage long before old age. Diabetes does not ask for your birth certificate before it starts harming you. It does not check your age. It responds to the internal environment of your body. A person may not look overweight and still carry dangerous levels of visceral fat. Someone may look thin and still be metabolically unhealthy. A person may still be considered young, while the pancreas, liver, blood vessels, and nerves are already under heavy strain. Some people do not even think of themselves as sick yet, but their bodies have already been paying the price of that denial. And that is what makes diabetes a silent killer. Not only because of how much damage it can cause, but because many people do not realize they are in danger until the damage is already advanced.
If we are going to talk honestly about death from diabetes, then we have to talk about the real pathways to death. Not vague warnings, not empty fear, but real, clinical, understandable pathways. The first is the heart. Diabetes is one of the major conditions that increases the risk of cardiovascular damage. Chronically high blood sugar, inflammation, blood vessel injury, unhealthy lipid patterns, and high blood pressure together create the conditions for reduced blood flow to the heart. That means the heart muscle may not get the oxygen it needs, and when that happens, a heart attack can occur. The frightening part is that in some people with diabetes, the warning signs are not always dramatic. Not every heart attack begins like a movie scene. Sometimes it feels like indigestion. Sometimes it feels like sweating and weakness. Sometimes it feels like shortness of breath. Sometimes it feels like unusual fatigue. And sometimes the person realizes too late that they were in the middle of a dangerous cardiac event. Some deaths in diabetes appear sudden, but they are not truly sudden. The damage was being built quietly for a long time.
The second pathway is the brain. Diabetes does not only threaten the heart, it also threatens the brain. When blood vessels are damaged, and when other risk factors, such as high blood pressure, inflammation, and vascular dysfunction are present, the risk of stroke rises. A stroke may appear as facial drooping, difficulty speaking, weakness on one side of the body, severe confusion, sudden loss of balance, or reduced consciousness. Some people survive, but they survive with long-term disability. Others reach treatment too late, after the most important window has already closed. Death from diabetes does not always happen in a hospital bed after a long decline. Sometimes it happens on an ordinary morning, when the brain suddenly stops getting the blood supply it needs.
The third pathway is the kidneys. The kidneys are vital filters. Their job is to remove waste from the blood and help maintain fluid and electrolyte balance. Diabetes, especially when it is poorly controlled over time, can damage these filters. At first, there may be no obvious signs, but gradually, the filtering function declines. Protein may begin to leak into the urine. Swelling may appear. Fatigue may become deeper. Nausea, weakness, and poor appetite may develop. And in advanced stages, kidney failure may follow. When the kidneys can no longer do their job, toxins begin to build up in the body. Internal balance begins to break down. And without proper treatment, that path can lead to death. Diabetes does not always destroy the kidneys loudly. More often, it wears them down slowly, quietly, and relentlessly.
The fourth pathway is nerve damage, foot injury, infection, and amputation. One of the most real and most frightening faces of diabetes appears in the feet. When nerves are damaged, the ability to feel pain, heat, pressure, or injury may decrease. That means a person may not notice a blister, a cut, a pressure wound from a shoe, or a small injury. Now add poor circulation. Now add slower healing. Now add infection. And this is where a small wound can become a major medical crisis. First, it is just a small spot. Then, a wound that does not heal. Then, an infection that goes deeper. Then, tissue that begins to die. Then, a decision that is no longer only about treatment, but about survival.
For many people, amputation sounds distant and unreal, until an ulcer, deep infection, or gangrene forces a physician to consider removing part of the limb to stop the danger from spreading. But even that is not always the end of the threat. A severe infection can enter the bloodstream, and once the body enters sepsis, the problem is no longer just the foot. Now, the problem is life itself. The fifth pathway is severe low blood sugar. Not every deadly diabetic emergency comes from blood sugar being too high. Blood sugar dropping too low can also be fatal. This may happen because of insulin, certain medications, not eating enough, heavy activity, medication errors, or a combination of these factors. A person may develop shaking, sweating, a rapid heartbeat, intense hunger, confusion, poor concentration, or unusual behavior. If it becomes more severe,
Seizures, unconsciousness, brain injury, and death can follow. This is one of the most difficult truths about diabetes. Blood sugar that is too high is dangerous. Blood sugar that is too low is also dangerous, and both can become deadly if they are ignored.
The sixth pathway is severe metabolic crisis, coma, and death. In some cases, very high blood sugar combined with major metabolic disturbance can push the body into a critical state. A person may develop extreme thirst, severe dehydration, dry mouth, profound weakness, nausea, vomiting, confusion, unusual breathing, or heavy drowsiness. In some crises, the body can no longer use glucose properly, and the internal chemistry begins to break down. In others, very high glucose and severe dehydration push the body toward collapse. If these conditions are not recognized quickly and treated appropriately, they can lead to coma and death. At that point, this is no longer about having a bad day with blood sugar. This is the line between delay and disaster.
Diabetes is one of those diseases where sometimes a single number can change the meaning of an entire day. A person may still be standing, still talking, still walking, still believing things are not that bad, and yet a number on a meter can reveal that the body has already entered a dangerous zone. The importance of that number is not just the number itself, it is the message it sends about what is happening inside the body. Sometimes it means the body has been under pressure for a long time. Sometimes it means damage has already begun. Sometimes it means an acute crisis is forming. And sometimes it means immediate medical help is needed. The tragedy is that many people wait for pain. They wait for the body to scream. But diabetes has shown again and again that it can cause damage first and symptoms later.
If a person has diabetes, prediabetes, or is at risk, this next part can be life-saving. Because many diabetic emergencies send warning signs before total collapse, and those signs must be taken seriously. Severe confusion, trouble speaking, extreme weakness, fainting, loss of consciousness, seizures, shortness of breath, chest pain or pressure, weakness or numbness on one side of the body, facial drooping, sudden severe vision changes, repeated vomiting, deep or unusual breathing, severe dry mouth, intense thirst, inability to stay awake, abnormal behavior, heavy drowsiness.
One point must be made very clearly. In a person with diabetes, confusion is not just being tired until proven otherwise. It can be an emergency. If someone no longer seems like themselves, if their responses become abnormal, if their level of consciousness falls, or if there are signs of stroke, severe low blood sugar, or a dangerous high blood sugar crisis, time is being lost.
So what should family members or people nearby do? This part must be simple, clear, and responsible. If the person is unconscious, having a seizure, showing signs of stroke, has chest pain or pressure, is struggling to breathe, or cannot safely eat or drink, call emergency services immediately. Do not delay. Do not wait to see if it passes. Do not assume it will fix itself. If the person is awake, can swallow safely, and low blood sugar is suspected, they should follow their medical plan or receive a fast source of sugar, such as glucose tablets or an appropriate sugary drink. Then be monitored closely.
But if blood sugar is extremely high and there is vomiting, confusion, severe weakness, unusual breathing, or signs of severe dehydration, this may be a major medical emergency and urgent professional care is required. If the person is vomiting, protect the airway. If consciousness is reduced, do not force food or drink. If possible, gather medication information, recent glucose readings, and medical history for emergency personnel. The role of family members in a crisis is not to replace trained medical care. Their role is to recognize danger quickly, avoid wasting time, and activate emergency help as fast as possible. In many diabetic emergencies, the difference between full recovery and permanent damage is time.
But fear, by itself, is not enough. If fear does not lead to a plan, it only exhausts people. So after understanding the danger, the next step is control. Preventing the worst outcomes of diabetes usually does not happen through one miracle action or one magical remedy. It happens through systems, through repeated correct decisions, through small actions that are done consistently. A proper prevention strategy has several pillars. The first is glucose awareness. Not obsession, not denial, awareness. Understanding patterns, understanding how your body responds to food, sleep, stress, activity, illness, and medication. The second is nutrition that does not leave blood sugar defenseless. Food should not only fill you, it should protect you. Enough protein, more fiber, fewer refined carbohydrates, smarter grocery choices, and a rejection of the dangerous idea that something is automatically safe just because it is natural, traditional, or homemade.
The third is movement. The body needs movement to manage glucose better. Even walking after meals can matter. Building muscle, improving insulin sensitivity, and reducing inactivity are all part of real treatment. The fourth is treatment adherence. Many people do not take treatment seriously until they feel very sick. They skip doses. They use medication inconsistently. They delay follow-up because of fear, denial, shame, or burnout. But diabetes does not give discounts for delay. Regular partnership with a physician, proper testing, medication adjustment, and follow-up are essential parts of survival. The fifth is protecting the organs that diabetes targets. Blood pressure control, kidney monitoring, eye exams, foot checks, attention to wounds, better sleep, stress management, hydration, and early action when infection or illness appears. You do not fight diabetes with motivation alone. You fight it with systems, with consistency, with awareness, with repetition. Seriously, improves daily habits and stays consistent with follow-up, risk can be reduced in meaningful ways. The speed of damage can be slowed. Many crises can be prevented. Quality of life can be protected. That hope is real, but it is not a false hope. It does not come from denial. It does not come from delay. It does not come from pretending that no pain means no danger. Real hope in diabetes comes from awareness, from early action, from discipline, from decisions repeated every day.
Diabetes is called a silent killer for a reason. It does not always arrive with pain and drama. Sometimes it arrives with thirst, sometimes with fatigue, sometimes with blurred vision, sometimes with numbness in the feet. And while those symptoms seem small, the disease may already be affecting the blood vessels, the nerves, the kidneys, the eyes, and the heart. Death from diabetes is rarely one simple event. It is a pathway toward heart attack, a pathway toward stroke, a pathway toward kidney failure, a pathway toward infection and amputation, a pathway toward severe low blood sugar, a pathway toward a high blood sugar crisis, a pathway toward coma, a pathway of slow destruction that may stay hidden for years before it finally becomes visible. But the earlier that pathway is recognized, the greater the chance of changing it. If you know the warning signs, if you take a crisis seriously, if you act at the right time, and if you follow the right plan, a great deal of this damage can be delayed, reduced, or prevented.
If you want clear, evidence-based, practical education about diabetes, blood sugar, metabolic health, and the everyday decisions that truly make a difference, subscribe to DiaSync. At DiaSync, the goal is not just to scare you. The goal is to make the truth visible, to help you understand what is happening inside the body, what is dangerous, and how to protect yourself more intelligently. And if someone in your life is living with diabetes or prediabetes, share this video with them. Because sometimes recognizing a few warning signs, understanding a few critical truths, and making a few correct decisions can genuinely save a life.